Seeing Clearly Month, and we're going to be talking with Dr. Jeffrey Schultz today from Lifetime Eye Care, and we're going to talk specifically about corneal molding, and it's a term, doctor, that I hadn't heard before. What is it?
Corneal molding, also known as orthokeratology, ortho-K, or corneal refractive therapy, all tongue-tying words,
yes,
is a way of reshaping or molding the cornea so we're able to eliminate the need or reduce the need for glasses or contacts during the day.
Now the cornea is that
cornea is the front surface of the eye, and that's where all the light enters the eye before it goes back to the retina.
Well, what is myopia? I hear that term a lot.
Myopia is nearsightedness. When the light enters the eye in a myopic patient, the light is actually focused in front of the retina. And the idea is to get that light back to the retina.
And so if it's focusing in front of the retina, your nerves are not reading it properly.
Exactly, exactly.
And what is myopic astigmatism?
Well, astigmatism refers to the situation where we have light entering the eye, and it focuses in two different places. Could be both in front of the retina, or one in front, or one behind the retina.
And we can see that in this diagram,
exactly.
correct?
Exactly.
And how about emetropia? Did I say that correctly?
Yeah, correct. Emetropia refers to the person like yourself who does not need a correction for distance. So as that light is entering the eye, it is now focused directly on the retina. And then the goal is to make those situations so that any light entering the eye is in focus.
Well, how does corneal molding address that? Is it similar to LASIK eye surgery?
Well, corneal molding and LASIK both try to flatten the front surface of the cornea so we get that focus on the back, on the retina.
And is it a difficult procedure?
No, it's actually pretty simple, pretty straightforward. We are taking a new design of a different type of contact lens, and it actually flattens that front surface out. The same way LASIK surgery, when we make a cut, flattens the surface. We're doing it with a contact lens.
So it just presses against it and changes its shape very
minutely. It doesn't take much to change the shape. So we are doing that gentle pressure on the cornea, and it allows that light to now focus on the retina.
Because if you think about how tiny that is, compared to the lens of a camera, it's much tinier, isn't it?
Exactly.
So a hundredth of an inch.
Well, we usually talk in millimeters, and we say that the cornea is a half a millimeter thick. So now we want to be able to address that very central portion of the cornea so that that light, as it enters through, will be able to change its focus point. So
what you're doing really is rethinking the contact lens.
Correct.
So the standard contact lens is what we've had around for a long, long time, but the contact lens reverse.
Right. We have changed the shape. A normal contact lens is round. The cornea is basically round. And when we take the shape of that the standard contact lens, it'll conform to. We make that shape so that they're the same. In orthokeratology, corneal molding, we're actually pushing down on the front surface of the cornea at the exact center. So as we do that, we have now flattened that cornea surface out centrally so we can get that light to focus correctly.
Doesn't hurt?
Doesn't hurt at all. No pain.
Actually, if you think about it, the eye really is a mechanical structure, and so there's no nerves in there.
Oh, there's lots of nerves in there. The cornea is a lot of nerves through the cornea, which you don't see. Their nerves are what we call bare nerves. So we're actually putting stress on the structures around the nerves.
So, but you get around the pain by...
Well, there is no pain because the lens is still fitting correctly. Okay, so by using the proper fit, we don't have any pain.
So that's the whole...
That's the whole game, really.
Knowing what you're doing. If you were to do this, would it last a long time, or would you have to come back for, let's say, an update? Well,
compared to LASIK, where you have to go through, we make an assumption with LASIK that it's going to be a permanent procedure. It usually is not. We have to do enhancements. And with those enhancements, we only can do one or maybe two if the patient is lucky. With Ortho-K, that lens can be changed if we need to make in other words, you are wearing this lens every single night. And if we need to change power, we just change the shape a little bit.
Well, I want to give a phone number that you can call for more information. Lifetime Eye Care. Dr. Jeffrey Schultz is with that organization, and it's 216-581-8484, or you can go to www.myeyedoc.com. optometrist.com and learn more about what we've been discussing here today. It's a pleasure to have you. Many, many thanks for coming.
It's a pleasure. Thank you very much.
You came so early, and I hope you enjoyed it.
Thanks. Thank you.
Nice to have you here.